The purpose of this presentation is to analyze and discuss an application used by healthcare professionals powered by On-Bound Medicine called Davis Drug Guide and Calculators for Nurses. The Davis Drug Guide and Calculators provides information on 5,000 generic and trade name drugs, offers many integrated calculators, and is regularly updated. This information provided through the app is FDA approved. This app is mainly intended for use by nurses. The main uses of the drug guide provide specific useful information on drugs, including general information on the drugs and pill identification, indications of use, mechanisms of action, contraindications and adverse reactions, drug-to-drug interactions and compatibilities, dosages, nursing assessments, teaching points for patients and families, and desired outcomes. The main uses of the calculators range from various types of clinical calculators like conversion and dosage calculations for IV drugs, height weight conversions, anion gaps, creatinine clearance, APGAR scores, etc. The app offers important information quickly and is at a nurse's fingertips. A nurse can look up a drug's mechanism of action and ensure safe administration to a patient simply and quickly. A nurse can also use the app to answer questions regarding a specific medication or use to educate patients on newly prescribed drugs. The calculators function of the app offers different types of calculators for nurses to use, particularly the IV drug functions to ensure proper dosages, rates, and conversions for safe administration and patient monitoring. The app can be readily accessed at the bedside for many uses as mentioned. The layout of the app is designed in drop-down menus so the user can quickly access the desired function. The intuitiveness of the app requires a basic understanding of what information is associated with drugs and various calculations used by nurses. The application is intended for nurses and thus the ease to learn the app is fairly simple. The workflow of the app is simple and fast. To look up a specific drug, simply tap on the search icon on the home screen and a text window will open. Once text is entered, various drugs will be listed and clicking on the desired drug will bring the user to the drug information page. To access different sections of the drug information, a section menu is located in the bottom right-hand corner of the screen. By selecting this menu button, the user can go directly to the particular section of the drug information desired, such as adverse reactions to a drug. To determine if a patient is experiencing a side effect, simply click on the Adverse Reactions/Side Effects under the Drug section menu and the app will go directly to that section of the drug window. The user can scroll up and down from here to continue reading about the particular drug. The information provided is clear, concise, readable, and easy to understand by trained nurses. Special features include a link to other drugs when researching drug-to-drug interactions, highlighted in blue. Also, a key indicates uses of capitalized or italicized words which tell the nurse important or common things to look for when administering drugs to patients. This provides an extra level of safety for the patient. Because the app offers regular updates, information provided is always relevant and reliable. There are no legal or privacy issues identified. On-Bound Medicine uses a team of experts to ensure accuracy of information provided so that the user can rely on Davis Drug Guide worry-free. On-Bound Medicine has been providing accurate information to healthcare providers for over 15 years. The use of the app is ethical because it is simply a reference tool for nurses to use to double-check drug administration, calculations, and educational points. This app offers a 30-day free trial before a subscription is required. The one-year subscription is $39.99 and is available for Apple, Android, and Windows smartphones and tablets, and is usable on all major web browsers. The benefit of this app is to allow nurses to quickly access pertinent information to use when calculating patient or drug information, assessment and administration of drugs and outcomes, provide useful teaching points, and suggest evaluation methods to determine patients' response. The use of the app is limited in that it is intended for nurses and require basic training and understanding in implementation of drugs and associated information. This app is definitely recommended for nurses to use regularly during practice, as it is a reliable resource to ensure safe drug administration and ideal patient outcomes. In conclusion, the Davis Drug Guide and Calculators for Nurses is a very handy app to use at the point of care. The app offers many functions related to drug administration, calculation, and patient outcomes. The app is easy to use and drugs can be searched straight from the home screen. Specific drug information can be selected from various drop-down menus to quickly access desired information. This app is only recommended for the use by nurses as it requires an understanding of associated information or drugs and how they are calculated and related to the delivery of nursing care.